So, had a patient who actually said something quite really interesting. She said actually she had sadly had some, well, sadly, of course, that she had it, but thankfully she's past it. She had throat cancer, um, and she said actually since then her wax has been a real problem for her. And I just thought actually it's worth sharing with you that it is known, one of the things that actually exasperates wax production, and it's a tangential effect, because the immediate effect that the radiotherapy has is on the actual skin that's produced in the ear. So the production mechanism of the skin that normally gets produced in the inner ear actually gets affected by the radiotherapy that's been happening on the throat. And because of that, actually it inhibits and makes worse the wax production. So the skin basically doesn't shed as well as it should do. So ordinarily the skin that's produced on the eardrum has two migration patterns. One is radial and one is linear, and it makes its way out of the ear canal gradually, and it brings the wax with it. But when people have treatment like radiotherapy, or they have chemotherapy on their ears or on their throat area, because of cancer, it can have an unfortunate consequence in making worse wax production. So I thought that was interesting just to share with you. But if you are going through that, or you know that somebody sadly has actually had to be treated for cancer, one of the effects of that actually is it sometimes can affect your ears. See you next time.